Hi guys, Dr. Sandy here from Inspire Medics. Today's short video is on the condition mitral regurgitation, something which is more common than mitral stenosis in clinical practice. It's a common clinical exam question on written papers as well as OSCEs and practical exams, and of course something you're going to see in your clinical practice as well. So what is mitral regurgitation? Basically it's a regurgitation of blood through the mitral valve during systole. And in terms of what causes mitral regurgitation, the classic and common causes that we should know of would include a prolapsed mitral valve, rheumatic mitral valve disease, connective tissue disorders, and in particular three come to mind, including Ehlers-Danlos syndrome, osteogenesis imperfecta, and Marfan syndrome. And of course you can get rupture of the papillary muscle, which can occur as a complication of a myocardial infarction. And also cardiomyopathies of any sort can also lead to mitral regurgitation. In terms of how does the patient present, they normally get things like shortness of breath, tiredness, lethargy and palpitations. The key examination features, and this is something which you should be aware of when you do a systematic cardiovascular examination, would include the pulse, which is usually normal, but you can get atrial fibrillation. A classic MALAR rash on the cheeks, which is visible in mitral regurgitation. On palpation of the heart, you can notice a forceful and displaced apex beat. When we auscultate the heart, you normally get a pansystolic murmur which radiates to the axilla. And then there are some key investigations that can be done for the patient. For example, a chest x-ray which shows cardiomegaly, an ECG that will show bifid P waves and left ventricular hypertrophy, and an echocardiogram which would clinch the diagnosis. And in terms of the management, if there's an underlying cause, we should treat that. If you identify AF and the rate is fast, then that needs to be treated. Of course, if there's AF, we need to consider anticoagulation for the patient as well, and diuretics also have a role. But the definitive management for patients who are not responding and who have severe mitral regurgitation would be either a repair or replacement of the mitral valve to improve the left ventricle function. I hope that video was useful. It was a short overview on mitral regurgitation. We have a lot more videos, learning cards, interactive whiteboards, and free questions as well for the PLAB 1 exam, for the AKT exam, and the GP Stage 2 entry exams and medical school finals as well. So lots of links here below this post for YouTube, Instagram, Twitter, and our Facebook revision groups as well. So I hope you find all of that stuff useful. Don't forget to like, subscribe, follow, and I'll see you very soon with another revision video.